a heart attack or stroke, although again, if they sit back, you all know someone who's had a heart attack or a stroke. Most women said it was breast cancer or lung cancer. And so this is something that we need to overcome if we're going to impact women and cause them to begin a regimen of prevention and to act aggressively to prevent heart disease. 1 in 3 women will die of heart disease. In some studies it's even higher, it's 1/2 of women. 1 in 30 women will die of breast cancer. If you look at women dying annually, 213,000 women die annually of a heart attack. 41,000 die from breast cancer and 69,000 from lung cancer. So the numbers don't lie. Heart disease and stroke are really major problems within our community. And if you look at all cancers, 260,000 women die of all cancers. Heart attack and stroke is going to kill 500,000 people this year, 500,000 women. So I said earlier that we don't do too well, physicians in the healthcare community don't do very well with treating women, and we'll talk about some of the reasons. Look at this. 2/3 of women who die from a heart attack have had no symptoms prior to having a heart attack that kills them. That's why they call this the silent killer. You're walking around, you just had lunch with your family, had Sunday dinner with your family yesterday, and then following day, you have a heart attack or stroke. How many people have seen someone at church, seen someone at work last week, they look perfectly fine, and then the next week you heard that they were in a hospital, or maybe even worse than that. And so it is truly the silent killer, and that means that we need to emphasize. Then after she gets to the hospital, she may tell the emergency room doc, "Hey doc, I'm feeling a little bit nauseous, a little bit sick to my stomach." So he starts looking for her gallbladder problem, or he starts looking for some other problem. It takes a while sometimes to identify that a woman is having a heart attack. That's not a good thing, but that's a fact. And what that leads to is an idea that it's better to stay out of the hospital and prevent this problem. Act early to modify your risk factors, because as a healthcare process, we don't do very well in terms of diagnosing women with heart problems. This says the same thing. Not only do we have a problem diagnosing women, but after women get to the hospital, they're less likely to get aspirin, beta blockers, cholesterol agents. As a proceduralist, women have smaller blood vessels, and so our outcomes when we treat women for strokes, when we do what's called a carotid endarterectomy to remove a blockage from a blood vessel, when we do a heart bypass, our results, frankly, are not as good as they are with men, because women have smaller blood vessels. There are a lot of ways and a lot of things that lead to the fact that women have having higher mortality when it comes to heart disease and stroke. And for all the women who are a little bit younger in this room, and you say, well, of course you're talking about my mother or my aunt or my grandmother. You cannot be talking about me because I'm a very young person. 9,000 women in the United States younger than age 45 sustained a heart attack last year. So it's not necessarily a disease of an elderly person. This can affect younger people. All of these lead to this basic principle. Basic principle is that we need to practice prevention. We need to instruct you how to eat better so that you can avoid heart disease. We need to instruct you how to exercise more efficiently. And we need to do our part to keep you outside of the hospital. But again, that's a little bit counterintuitive, because hospitals don't make money when you stay at home. Doctors don't make money when you stay at home. Seminars like this, critically important to get this message across. We want to switch gears for a second. I want to talk about stroke. You all know that there are strokes, and they all affect people's brains, and I told you how significant they are. There are 2 types of stroke. One type of stroke is in someone who has high blood pressure, and essentially your blood pressure becomes very high and it causes you to bleed into your brain. The other type of stroke is from someone who experiences a plaque that breaks off from their neck and heads to their brain. And that causes a lack of blood flow to a certain area of your brain. Both of these are very, very bad. And they're very bad because they affect women disproportionately. And they leave women, those women who survive, over 60% of women are severely disabled from a stroke. So if you don't die, you live, but sometimes you wish you would not have lived because you're severely disabled. You may not be able to walk. You may not be able to speak. You may be in a long-term rehabilitation facility. Stroke is a very bad process and a very bad disease. What are the warning signs of stroke? Again, if I want you to go home with an important point and to remember some ideas, this is one slide that you need to remember. Women can have anything from slurred speech. You can have vision problems, usually on one side. You may have difficulty moving your arm, difficulty moving your leg on one side usually. Or the worst headache, some women describe the worst headache ever. Those are very important. It's very important to know these warning signs because when we talk about stroke and when we talk about heart disease, time is critical. From the time one starts to have the symptoms to the time they get to the hospital and get effective treatment determines how well you will do. There can't be any dawdling to say, well, maybe I should or maybe we should not take grandmother to the hospital. Things have to happen quickly. A person has to get to the hospital. Not only when they get to the hospital, they're in the emergency department. We can't let people having a heart attack or having a stroke sit in the emergency department while we wait to triage them. If you live in a community where, well, it's a smaller community hospital and for big problems, you get flown out to another facility, well, but it also causes disorders like Alzheimer's and arthritis. And so not only does the food that we eat affect the development of these chronic disorders, but our lifestyle, how we exercise, the choices that we make, whether we smoke or not, affects the development of this process. I'm just going to talk real quickly about weight, because I think when we talk about obesity and when we emphasize weight and weight loss, we kind of take the focus off of what we should be looking at. We should be looking at or trying to make people healthier. And part of that certainly is encouraging people to eat right and to exercise more. And when you do that, your weight is going to be more easily controlled. But the focus should not be on losing weight, because there are skinny people that eat poorly and that I treat for heart attacks, strokes, and amputations and kidney failure because they ate poorly and they had a lifestyle that was adverse, smoking and other things. And so weight is not the end-all and be-all, but it is an important factor. And this slide shows what our country looked like in 1991 when they were, if you look up here, this means that 20 to 25% of people are obese. 1991. If you look in 2001, you can see how much things have changed within a short period of time, 10 years, and that we have a much higher rate of obesity within our society. What does weight gain do? It increases the strain on your heart, it raises your blood pressure, it increases your risk of having diabetes. What's very concerning, and again I say this to all of you because I know all of you either have children or grandchildren or nieces or nephews, the rate of obesity within our childhood population before diabetes was unheard of in children. The only time children had diabetes was if their pancreas was not functioning. It was called type 1 diabetes. It was not type 2 diabetes that we see in older folks. Now, 15% of children, in some communities as high as 20%, have diabetes. So you're talking about a child less than 15 years of age, because of their overweight state, is on insulin or some other medication to control their blood glucose. And it's so bad that we think that this generation of children may be the first generation to routinely die before their parents. Can you imagine that? You're looking at your children and you're watching them grow up and you're hoping that they're going to live a long life, but due to the complications of diabetes, you see them in the hospital and you see them die before you. That is terrible to even consider, but that's the way that things are going. And diabetes is such a difficult and terrible disease. I want to show you something real quick here and then I'll go back. Diabetes is such a difficult